Okay. All right. So hopefully I did this right. Um, it says live, and I'm gonna trust that it's somewhere on the YouTubes. Um, so for those who tune in live or those who catch this later, just thank you for clicking on the stream. I know I don't come on very often. This is I'm Theus, Complex Mind, Simple Man, and I have my illustrious guest Anna Hart of Borrelia, etc.com. If you'd like to go ahead and introduce yourself, Madame.
Sure. Okay. Hey, everybody. I am, as you said, Anna, and I have lived my entire adult life with multiple chronic illnesses. When I was 17 years old, I was bitten by two ticks. I was out on this really gorgeous camping trip. I was out with Native American elders. We were protesting, we were celebrating, and having all kinds of ceremony going down that river. The Wabash River in the middle of the country, where one night on one side I'd be in Illinois, the other night I'd be on Indiana. And there's a lot of ticks there. Some people call it tick country. And I was bitten to a point where I had bullseye rashes, which is a telltale sign. If a doctor sees that, they're like, oh, you have Lyme disease. You need to be on antibiotics. And usually, if a doctor sees that, it's no trouble at all. A doctor didn't see me really for 8 years and figure it out. So I had a lot of stuff go wrong with me over that time. And the the toxins that ticks carry are pretty serious neurotoxins, and they can affect the brain very easily. They cross the blood-brain barrier, and I started having seizures. I couldn't walk right. I have been through the ringer with this body, with this mind, and I have done an awful lot to climb back out of disease and unwellness. So I have a very intimate view of our current health system. I hate it. And I greatly want that to change. So I am super glad to have opportunities for conversations like this. So I'll wait for you to say a little bit more, I think. But
Oh,
that's basically me. I'm 45. Live in Washington State. I'm an activist. I really love history. Um, I keep myself busy. I run support groups on the weekends usually. Uh, when I'm not on with you guys on YouTube. So that's me in a nutshell.
thank you, Anna. And
Hey,
hey,
Tracy.
Tracy, welcome, welcome. So before I hand over to Tracy to introduce her glorious self, so guys, this is a really cool panel that we have here so far. So a little bit about me. I am 47, I think. I'm either 47 or 48. I'm one of those two numbers. But my background is in financial services. So that's life insurance, health insurance, um, index retirement planning, banking, right? I'm that, right? So I sell the stuff or I've serviced the stuff.
Okay.
And of course I'm a consumer, right? So I'm full-time employee. So that means I have a group health insurance plan that I utilize for myself and my family, right? So you got me, I got my background as far as like the structure of the insurance industry. I have certain biases that are built in because of how I came up, right? My degree is in finance, right? So this has been my life for 30 years. Um, and then you have Anna. Anna, as she just shared with you, like having her whole adult life, having to interact with the health insurance system and provider care and loops and the hoops and all the other little stupid things that you got to deal with.
Mhm.
And now we're going to segment to Tracy Media LLC, Miss Carson, and she can speak for herself. Welcome, welcome.
Hello, everybody. Everybody, hello. I guess I'm supposed to be saying what my background in healthcare is.
Well,
So
just
I'm
introduce
just
yourself. No, just
I'm
whatever.
Tracy. I was born in 1974. I'm Black. Happy Black History Month, everybody. Um, of course, I have. If you don't know, well, where is Marlon at? Why is he in here?
He's not feeling so good right now.
Oh,
Uh,
right.
well, I have type 1 diabetes. I've been diabetic since I was 27 years old. You can imagine I have a whole lot of things. I have uh, a Dexcom, insulin pump, Novolog, high blood sugars, low blood sugars, hospital stays, um, chances of kidney failure, eye failure, uh, loss of feeling in my feet and hands.
Mm.
Diabetes isn't fun. And so when you're going through that system and you have to pay for those things out of pocket, um, that's a lot. That's a lot. I know I always tell the story and I'll make it quick because I don't want to babble on, but my insulin pump cost $3,500.
Well,
Now, if you look at me, I know you can tell I don't have $3,500 just sitting around somewhere where I can just access it. Thank goodness I met my out-of-pocket maximum. That's the only way I could have afforded it. But this is the challenge that we face, right? We have to figure out how we're going to get supplies and tell our insurance company, um, ask our insurance company, do they have coupons? And then the coupons, I was on Magiro, $364 for a 1 month supply with the Savers coupon. So
hmm.
obviously I had to switch medication. So now I've got to switch out, and that's frustrating. So I started becoming an advocate for something I'm going to talk a whole lot about: Medicare for all. Um, Medicare for all is the only answer to what we are going through today. It is the only reasonable answer that works. It actually works. It's working in other countries. It could work in America if America wasn't dictated by special interests and big pharma and big insurance companies. I don't like insurance companies. They're just an unnecessary middle person that is just there to take away care. And that's pretty much it. And I'll probably just be going off of a lot of soapboxes tonight.
Hmm.
That's great. That's great. So, Anna, were you about to say something?
I was just smiling.
Yeah.
I
So,
know. I just know many of her gripes and share.
and I hope to get into some of them.
Hmm.
Um, we won't probably have the time for Tracy to unload the whole bag, but some really great things to kind of touch on. So the reason why I asked for everybody to come together today is we want to talk about, you know, universal health care, Medicare for all, national health care, whatever, whatever that thing is, and actually talk through a few things. So I'll be interjecting my perspective. You guys already know, but just kind of really exploring it a little bit. And so let's just kind of jump into it, right? So let's see here. First thing that I had put on was about branding, and in short, branding is just, well, what do you want to call this thing, right? And from there, we can kind of break in a little bit. And I actually just got ahead of myself to level set a little bit of this discussion, because we'll probably get into it at various points. There are key terms that we are going to deal with, or you'll hear me bring up. All right, so you have things like deductibles, co-pays, premiums, right? Law of large numbers, insurance pools, adverse selection. Like, these are things that you kind of have to consider when you're trying to structure a plan, whether you're trying to do it from a company level, like a United Healthcare type of thing, or you're trying to do it at this national level, that I think all three of us are kind of on board with. We just may have different takes on what it looks like, right? Is that a fair? So I don't want to put words on nobody.
That's absolutely fair for me.
Yeah, that sounds about right.
Cool. So any questions from those watching, or either of you, or if you want to explore any of the terms that I just dropped?
Well, a few of those I was not familiar with yet, that you listed later on. And I did want to start out with, I hate Medicare for all, because everybody immediately thinks that everybody gets Medicare, which absolutely sucks. I mean, my mother gets every season a $666 bill. She has to pay, and I'm not making up the number either. 666.
Yeah.
Every quarter, and it's for barely anything. So I often look, I'm on Medicaid, so I don't have to give money out of pocket. I get what I need, what is medically necessary, usually covered. But I often look at actual Medicare rather, and I feel like bad. Like, I feel like I have a better system than my parents do at this point. My preferred term is universal healthcare and single payer. I think single payer should be in there somewhere to have people understand that we don't need insurance companies competing with each other to make money.
That's a fair point. So I have kind of the same concern with, and this is a branding thing, with it being called Medicare for all, because I'm more familiar with Medicare, right? So when you say that, it has a meaning to me. And then when you start describing big you, just like random you, start describing what Medicare for all means, that says to me universal healthcare. It doesn't say Medicare for all, because Medicare already exists. So if you say Medicare for all, then it means everybody gets that. And first, I'm not against Medicare. I think it's actually a good social insurance program. It's gotten away from what it originally was intended to be, and that's because of our hyper capitalized system. Very few people are actually on Medicare now. A lot of people are on Medicare Advantage, which is like Medicare, but it's not. So that's why I agree with you on that point. It's like it says something to me. My preferred term would be national healthcare or Americare, if you want to be like corny about it, because I think when you're trying to market something, you're trying to market it in a way that people who are kind of preset to oppose things, what can they latch onto? So Medicare for all, you already got conservatives that have decided no Medicare for all because they've been taught that for 30 years. And then you got universal health care that screams progressives. So now they've kind of dug their heels in a little bit on that. I'm not saying none of these terms are good and you can go with any of them. I'm just saying like why I would say like let's come up with a new term that is vanilla enough for the uninformed and the people who are emotionally opposed to something they can attach to. Example being Affordable Care Act, Obamacare. People who hate Obamacare like the Affordable Care Act. Why? Because they have an emotional response to Obama. Right? So give them AmeriCare. This is me stating my point. Then I'm going to let Tracy do hers. Give them AmeriCare or Patriot Care, right? And now they're like, oh, well, yeah, that means it's for Americans, and it means it's patriotic, and it means illegals can't get it. All the same things that the rest of them are, but okay, if that's what you need, a nice word, we'll give you the word. So that's my thought. Tracy?
Oh boy, do I disagree with what y'all said. The reason that we use the term Medicare for all, or the reason I use, because I use all three terms. I use single payer, I use universal. I probably use Medicare for all because in the activist realm, that's what people around me use. So I tend to just pick up on it. It's because Part A of Medicare is free. Once you turn 65, Part A is free.
It's not free.
Part A is free.
Nope, not free.
My mother
Part
pays
A
for
is
it.
free.
You have to have sufficient working hours for Medicare A to be cost free. Yeah. So I'm just saying that's why, like me and say Anna would be like, hey, slow down on the term because
I don't care what you call it. You could call it free health care for everybody. I literally don't care. I don't care if you call it universal. I don't care if you call it single payer. Single payer might confuse people because they're like, well, what does that mean? I'm not concerned about what it's called. I'm concerned about why we don't have it. And it really frustrates me that we have politicians in Congress that get free health care, get the what I call Cadillac plan. They get that Tesla, BMW, Porsche plan for free out of, well, I know I'm an MMTer, so I'm not going to say our tax dollars, but they get free health care that they do not have to pay for it. Somehow it's okay for them to say, no, you don't deserve it. I'm more concerned about that than what I literally don't care what you call it. You call it whatever you want to call it. Free care, social care, AmeriCare, Hands Across America. I just don't care.
I'm with you there, but here's the thing.
That's not bad. Hands Across America.
Well, now that sounds too black right there. We can't be doing that. It makes you think of we are the world. We are the children. You know that's what Hands Across America was. That's what we did for South African apartheid. We are the world. Hands Across America. We all went on the playground, held hands.
Y'all did that mess because I wasn't in it. But can I say this? We don't have Medicare for all, socialized medicine, because it would benefit Black people. If you look at the Eisenhower administration, this is not some new idea that just pooped up and Bernie Sanders got it. He got it from Jesse Jackson. Jesse Jackson got it from someone else. He literally said, we can't have free medicine or socialized medicine because it will benefit Black people. That's why we don't have it. That's exactly why we don't have it.
That is a huge part because in America, almost the unspoken line has always been the color line. Okay. And we can go on a whole nother tangent arguing and discussing and exploring why America is obsessed with race. But you're right that I think a huge portion of why we don't have a national health plan is because of Hugh gets it, not who gets it. Hugh, Hue.
You get
It's
right.
about who is it that I have to share this benefit with, and so long as, and here's an excellent way to look at it. Our current health system allows for emergency care for anybody, no matter what. And yet, we have an entire movement, a federal national movement to identify, isolate, and terrorize undocumented people because they might go to the emergency room and get free health care. And that's just a stand-in for color. That's all that is, right? So
Right.
I agree with you, but we are moving into a time, I believe, that you'll be able to push harder for this national plan, mainly because so many people in America, regardless of their ethnicity, are being crushed by a clear income issue, right? So if you go back to right before desegregation, America had it where you had state level college education, you didn't have to pay for that. Right?
Yeah.
When they put Social Security in place, they intentionally put the carve outs for the areas that women and minorities work in so that they couldn't get it, right? To keep the women beholden to their men and to keep the minorities out altogether, right? So we know the color and gender bias is in there, but if we're going to put something together, so that's what the big presupposition here, we're going to put something together. I think that there is value to what we call it. I'm gonna let Anna say something on it, and then we'll move to another thing because it's not the big piece, right? It's just the window dress. But anything you're trying to move, you got to sell it. You got to sell it, and names matter when you're trying to sell it. You know, what was that thing? Defund the police.
Yeah.
Just because of the name, they latched onto it. Now, I'm of the opinion they would have latched onto something anyway, no matter what you called it. But words matter. Anna?
So that basically was going to be my point. Branding is worth at least a little part of the conversation to me, because there are people who have visceral responses to Medicare for all, whether that's not liking what that says or thinking, oh my God, that's a left thing, and I can't support that because it's a left thing. Yeah, we need a name that gets beyond all of that. I really do believe we are at a point where the country is asking itself, or at least a good portion of the country is asking itself, what kind of a country do we want to be after we have a period of accountability? So there are those of us who really do want to stand up for what this original Constitution said. And to me, it was saying all people are equal. And that's always the way that I was taught, I was brought up, and I have seen the ways this country falls really short. But the conversations that we're having right now are very encouraging.
Yep. And it's like you just mentioned, like, because it's a what do you call it? A pressure point, especially in our community. Like, we respond to it viscerally when we hear all people are created equal, because we know that when they wrote it, they were lying. Like, when they wrote it, that wasn't what they meant. but that was back there. So now let's make it mean what it said, right? Not what you meant for it to say. Let's redefine it for what it should be. I think that's a powerful moment for all of us to kind of try to latch on to. What type of country do we want to live in? And now, how do we put the building blocks together to get there? This discussion is on national healthcare. Other discussions are on other things that I'm going to bring up, in the future. But it's all from that lens, right? So yeah, thank you, Anna. That's dope. So Tracy, because you are so invested in this, I'm gonna ask you to lead off on if you were building a national plan, right? What are your thoughts on how that would be structured? Like, how would it work?
The insurance companies would not be included in the administration of the plan at all. I don't want their little dirty, grubby, corporate, slimy hands on any part of any type of insurance. They make me sick. I do not like them. I will never like them. I don't like them. I wish they would go out of business. However, I will say this because people are going to say, what about people that work in the insurance industry? So I'm about to answer that question. So there is a bill, Senate bill. I know Bernie Sanders wrote it, that talks about a 2-year plan to get the people that currently work in the healthcare system right now, get them trained on the billing, the customer service, all of those prior authorizations, all the little things that it takes to ensure that we have national health care, or as Marlon calls it, don't let us die care. We can't really call it that, Marlon. We can't call it that, but we can call it free health care for everybody, RX. Like I said, I don't care, but I think that's the thing. And we have to have, because let's just say Trump is not going to do this. He's not going to do it. So because he's president right now, I got to put his name in it. Let's just say tomorrow Trump signs the Medicare, the universal health care bill, and everybody gets free health care.
It's Trump care.
Yeah, well, yes, thank you. It'll have his name on it. And somebody is going to take this to the courts. So you have to prepare yourself for the legal argument to make. That's the first step. You're going to have to make sure that you prepare for that legal argument, because some conservative is going to say it costs billions of dollars. Let's not forget, or let's just, keep in mind, they find money for wars. Find it all the time. I mean, we could have $0, but they'll find it for war, but can't find it for healthcare. But we have to make the legal case first. We have to make the moral case also, because most Americans are going to say that's socialism. And I would say, yes, it is social. It is a social program. So is Social Security. Social Security is a social program. It has social in the title. Socialism is not bad. So that's going to take educating Americans. Then we're going to have to get used to the fact that, I don't have to wait to go to a doctor. I can just make an appointment and not have to worry about, well, is that doctor in network or out of network? And I got to meet an out-of-pocket maximum, and I got to do this, and I got to do that. All of that goes away. So you got to make the legal argument, the moral argument, and the economical argument. Universal health care actually saves money. It saves money. So all three of those arguments have to be made together. You can't just have one and then just skip the other ones.
So let's touch on those just a little bit. So the first one that you touched on was about all the people, the disruption to the existing insurance market. So it's all well and good and this is me pushing back on the idea, okay? But I agree where we have to go. I just want people to actually look directly at this and not just take it as a given. So saying that we can just retrain the people and absorb them into a national system, because in order to run a national system, let's be real, you're gonna have to set up a huge new agency or arm inside of the government. Okay. So folks, when you hear people say, well, we'll take those employees and we'll shift them into government workers, that's what they mean. They mean we're going to take the existing people who have expertise and we're just going to refocus them. So it's not about a profit chasing motive. It's about a government thing, right? Now, the thing about that is I did like a quick search and just the top three insurance companies by revenue. You got, where did I put it?
It's got to be United,
Blue
Elevance,
Cross.
and
So it
well,
was
Blue Cross is Elevance, I think.
it was
Okay.
United, yes.
Yeah.
Where is it? I just had it. I didn't do too much looking up. United Healthcare, CVS Health, and the Cigna Group. That's the top three by revenue. Now, between those three, that's over 700,000 employees that we know of. Okay. Now, that is all levels, though. Okay. That's the insurance company and all the little things they got going on, the pharmacies and all that stuff, right? So you're talking, not you, Tracy, but just this concept, those who take that approach, you're talking about roughly 1 million people that would be told or encouraged or whatever to move over. All of them ain't gonna move over. Let's just be real, because you got redundancies. Okay. I don't need the same number of the same type of role in all of these things. The reason why there are so many of them is because you're all competing against each other. So we don't want to just take that glut, dump it into the federal government, because we know the federal government is wildly inefficient. So, but that's what we would kind of be drawing from. So just to put a number behind it, and that's just the top three. So we're definitely well over 1 million employees. Just looking at that part. Then I think, what was the second part? The second part was how it would save us money, or was that the third one?
No, the third part was how it would save us money. The second portion is the moral argument.
Okay. So can you kind of restate the moral argument
Yes,
for me?
because people, and I don't like to call people idiots. I'm trying not to do that so much in 2026. I'm really trying. Yeah, I'm trying.
Read the
But
book,
people
How to
that
Make
argue,
Friends.
I called somebody a nitwit last night, so I'm trying. I'm really trying, and it's not succeeding so far. But people that argue against Medicare for all, the Ted Cruzes, the Rand Pauls, the Mike Broms, will say, well, it's socialism, and you got the government will control medicine. Well, how is it working now that insurance companies are controlling it? It's working for you because your health care is free. You don't have to pay for anything. I'm out here struggling, figuring out, well, how am I going to pay for insulin? How am I going to pay for Ozempic? And how am I going to pay for da 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 da?
Okay.
And there's another argument I didn't make. This would save businesses. A benefit to businesses would be they don't have to contribute to premiums anymore. They get to say, okay, we can put this money somewhere else. Now, they may have to think of other benefits to have people work for them, but I never thought about, I just literally thought about that. Companies spend, like, you get health care and you could like shift that over and say, hey, I don't, as a small business owner, I don't have to pay for employees to have insurance. It's going to help small businesses that don't have to, they can hire employees now because insurance is a beast. You have, it's going to help larger corporations. Now they don't have to pay up to 75% of insurance costs. Now they don't have that. You have more money in your check because money isn't coming out of your check to pay for premiums. So now you have more money in your pocket to spend. So I make that argument to people too, because but the socialism argument, I'm like, but we live and socialize. We live in a social society now. We have Social Security, we have police officers, we have teachers, we have all of those are paid out of what's taken out of my check.
We have been making that argument forever. It's not going to win. Okay. So, because for example, you said the Congress people, for example, they have the Cadillac plan. Here's how they defeat your argument. I don't have socialized medicine. I have an employee group plan, just like you do at your job. That's how they come at that one. So,
but nothing is taken out of their paycheck to pay for that plan. There's a big difference between. See, they're talking to a person that doesn't know.
No, but right? That's most people. Okay.
Right. I get what you're saying. But I would say, as a person that does know, okay, you have a employer plan, but the wife, the adult children that are well beyond 26 years old get on that plan.
Do they?
Mm-hmm. Yes, they do.
Yes, they do. They absolutely do. They absolutely do. They absolutely can get health care for free based off of that. So you are told that your child, well, I know Thea has just daughters. Once your daughter turns 26, that's it, and she's on her own. They can keep their children that are 32, 33, and 34, and 35, because Congress, they are old. They up in there. They up in there. They not no spring chickens. So to me, you're not gonna just make that argument to me. We have to make Americans aware of, hey, they're not paying nothing. They get to put their spouse, their children, their dog, their cat, and the refrigerator on the plane.
So I gotta pause you. I just did a quick search, and 26 still applies to them too. But they have other perks that they play games with. So I'm gonna hit this piece, and I'm gonna give the other piece to you, Anna. So you touched on the businesses, how it will help the businesses. I agree it will help the small businesses, because now they don't have to. Because I've had small businesses. I'm trying to start another one now, and I know if I'm trying to employ someone, I can't offer them benefits, which means I can't hire very many people because I can't hold that expense. Because once I think it's like 50 or 100, one of those two benchmarks, you hit one of those, you have to offer something.
Right, you have to offer.
So it can be cost prohibitive for a smaller business, and then there's other thresholds too. You're just competing for talent. You can't afford it, right? So yeah, I agree with you on the small business part, but as you get bigger, they write that stuff off. And so they get to play their own games. They're actually part of the problem. The corporations are part of the reason we don't have national health care, because they like the fact that you're anchored to them, and then they get to play the other side of the game. You have to work for me in order to have health insurance. And each year I'm trying to find a way to save money on your health insurance. So they keep reducing the quality of your care, but your premium keeps going up because there's no true competition going on. But I want to hand off the moral part, like the whole socialism argument. Anna, would you be willing to talk through that a little bit? How you get over that, beat that with that?
This is something that I'm actually still really puzzled on myself, because this country has a very deep-rooted reaction that was taught to them and reinforced, especially about communism. And we know many people can't tell you the difference between communism and socialism. Like going back to that, the better country that I want to see education open up in so many different ways, so that we can have a populace that does know the difference and does know that we have social programs up the wazoo, and they only get far more beneficial the more money that you have. You know, we all have streets we can use. We have firehouses. Socialism is not a new thing. Community is not a new thing. We all should be able to reach inside and say, yes, I want a whole bunch of stuff to happen for the health industry because of all the pain that I have seen on it. I want everybody to have the same opportunities. And so I think it starts with conversations and very much at home. And like, do you think it's socialist to volunteer to a free clinic? It absolutely is. But, you know, like, we have to reach in and get rid of this negative seed that was planted alongside the word. We have to exercise that out because it's a great hinder as long as people are just gonna go, no, 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 no. How do we talk to that? And
I'm sorry.
no, sorry, I'm starting to circle around. So go ahead.
I think that we got to find it. I think it's a better approach because education, slight pivot, because you guys know I'm hyper focused on education. We can make education better funded, and we could reinvest in our schools and pay all of our teachers more and all of those things. But the thing is, as a society, we have a cultural rot that has set in for the last 40 years. And so I could give you all the information you want. You're not going to take it. All right. I deal with suburban kids who are not missing a meal, ain't got a hardship beyond what their imagination tells them it is. Right. They have inconveniences that they have taken in as a hardship because that's what's relative to their life, right?
Mm-hmm. Mm-hmm.
They don't want to learn. And it's not because they individually can't learn, it's because we have a cultural rot that doesn't encourage it. So I could make civic education and I can make political education in every high school. Kids gonna be sleeping every last one of them classrooms. Okay, so that's just my quick pivot, because I want to have an educational discussion later, but that's part of what we gotta deal with. So given that is so deep seated, right? When people hear, like you said, people hear socialism, they immediately hear communism, which they immediately tie to Russia. And so all they know, Russia bad. So Russia bad, so we're going to come backwards. Communism must be bad, and then socialism must be bad. Not paying attention to the fact that America has never been a one thing. It has always been a blend of things. We are not a capitalist nation only. We have a mercantile system that still exists. We have a royalty system. Like our Congress people are like barons, and our corporate overlords are like kings and queens. So we still have a monarchy type thing. We even have this culture of celebrity. It's treated like England would treat their their kings and queens, right? We would put Beyonce in the kind of awe, or Taylor Swift in the kind of awe that we will hold for Princess Diana, right? So we have all these things happening, but because of the propaganda that is pushed on us, we emotionally react to these things, which the global elites and everything, they want us to do. I get it, I know, but it's deep. So the cynic in me says, let's go a different route. Like I said about Patriot Care and AmeriCare, I think both of those terms are kind of goofy. But from what I've watched amongst our brethren, it'll probably have a lot better attachment than universal health care or national health care, right? So if we take the fact that people have emotional attachments to things, and we, instead of saying, hey guys, socialism is already a part of your life, man, get on board, you stop being stupid. Instead of doing that, we go with, you're an American. And being an American should mean something. We're the best nation on this planet, and we're just not acting like it. So how can we sit here and justify to ourselves that some little Rudy Poo country in South America gets to have health care as a benefit of being a citizen there, but you ain't got it here? America owes you. They owe your children. Right? Find the wording that'll help crack that little shell and say, no, we're not doing this because, we want to do right by everybody. No, we want to do this because you're owed this. You out there in Arkansas, out there working that farm, having to produce even at a loss, because right now they at a loss, whatever. They can grow it and they still lost money. Okay. The least America can do for you helping to feed this nation is make sure that if you get hurt out there in that field, that somebody can get to you and get you some help and get you help quickly, right? And then not bankrupt you for doing it, right? So it's cynical. I get it. But perhaps that would help us get around a few corners. Because one of the things that I get so frustrated with the so-called left is we, whatever, believe we have all the right ideas. And it's just a matter of the other side being too stupid to realize it. You will never win that way. You will never get anywhere that way. No one in the history of intelligent interaction has been like, oh yeah, you're right. Like, that's not how it works. So how do we bring them together to achieve a specific result? And sometimes that means manipulation. And I am all for manipulation if it gets us to the better place that, like Tracy was laying out, we need to get to.
I definitely can see there's a good, strong argument you're making. As long as it's not called Trump care, like I said, you could literally call it Mickey Mouse plan. I don't care. I really don't care, but I know Americans pay too much, especially our seniors. That's where my concern lies, is with our seniors. I know we as a society, we don't care about our seniors, and we just say, you're too old, you should just sit down and let the younger generation take part. But our seniors are literally making choices between prescription drugs and food. And it's just like we're okay with it. We're just like, oh well, okay, they're old anyway. It's like, huh? But yeah, you're right.
We're okay with it because we're not made to look at it.
Yeah, we're not made to look at it. It's like, well, and I'm like, well, how can you? I've always just seen the moral argument for universal health care. I'm just like, how do you say to somebody that healthcare to me, it's a right. You have it because you were born. That's it. You were born, you deserve it. That's it. Now, where you get into the murky part of it is for conservatives, are you going to do things like gender affirming care? Are you going to do things like reproductive health for women? Are you going to, you're going to have to sell those things because they're not going to buy into a plan and say, yeah, we're going to pay for abortion. Yeah. I mean, I think, yes, obviously you would pay for those things. But I can't see making that point to a Trumpite. Yes, that's what I call them now, Trumpites.
The Trumpians. So I like that. That's a great pivot. That'll pull me off of what we were just talking about. So there's different types of care, right? There's emergent care. There's preventative care. Family. There's chronic and critical care. And there's elective, right? There's elective. So I would say, and it's not my purest position, because my purest position says no one gets rich off of receiving medical care. Okay, except maybe a celebrity if they got unlimited facial reconstructive surgery and they can get the Trump duck face and get paid for having it. But generally, but they paid for that, so they put their money down and they did that, and if they make money off of it, congratulations. But generally, no one gets rich from receiving healthcare. So that's my purest argument. That's why I say everybody should get it. Everybody, including the illegals. Okay. But that I know that would never fly. Okay.
That's not going to.
First of all, it's irrational. Let's just be real, because that's my emotional position. It's irrational. There's no way that a national plan should provide the same kind of coverage to someone who is not a citizen of that nation. That's just not rational, folks. I'm sorry. It's moral, not rational. So that'd be the first thing. Make sure that you're a U.S. citizen or got legalized status, like green card holders. That's pretty much it. Green card holders.
What about students?
If you're students and you're here on a visa, no, you're not a citizen. But this is what we do for that. This is how, to me, you address it. You have the national plan, right? So you have to be a citizen or you have a green card because you've been issued a social security number if you have a green card and all that, right? You're trackable. We know what you're doing and you're paying all your taxes. But if you're here on a visa, work visa, student visa, whatever the visa, then you should be able to buy into the private market, because no matter what you do here in America, there will be a private market. You're not going to get rid of it. Okay. So you have the national structure and you also have the private structure. And if you look into many of the developed nations that have a national plan, there is also a private market. Because that's how expats get insurance when they go to another country. That's also how the wealthy make sure they get the type of care they want, because they ain't trying to go to the same office you're in. Right. So make sure that option is there. There's no harm in it. That's the capital market. That's the free market. I don't care. What I do care about is that the national plan is well structured, has good oversight, and is not allowed to perpetuate many of the same ills, because it doesn't benefit me one lick to have everybody have health insurance and we still have disparate outcomes for people who have disabilities or women, especially like Black women, who have a very high mortality rate in giving birth. If you can't fix those, if you're not serious about addressing those, then I don't want national health care. I don't want universal health care. You're not going to have me pay into something and you still screwing my people over. I don't want it. Right? So we got to be serious about not just making coverage available to everybody, but making sure that the coverage is right, making sure the coverage is as fair as possible, and really investing in that. And that part of the discussion oftentimes I think gets missed. And the kind of Congress we have right now would absolutely get missed. But I just think that that's a big part of it. You were saying gender affirming care, reproductive care. First of all, in my view, reproductive care, that should be part of the national plan, bar none. That's just care. Mental health care is also, that's just care. 40 years ago.
Can I say this? We believe that, but let me tell you the opposite. There's some Bible thumping conservatives that will absolutely, if you say yes, we're going to cover abortions up to women, for women, they will absolutely, positively get out in them streets and start protesting against what it is we should have.
Agreed. So here's my concession. Now I would negotiate from a different position, but I'm not an authority to make any of these decisions anyway, so I can be out here saying it in public. My concession to that is it would still be a national plan, but it would also be state run, similar to how Medicaid is state run. Okay. Because if in your locale, you really do believe the way that you believe, and enough of you believe that way, who am I to impose that upon you? Right? I would agree. Now, my position is that abortive care and all of those types of things, that's medical care. And if the woman and her doctor get together and that's what needs to be done, then dagnabbit, then let's do it, because this person went to school and has dealt with dozens, if not hundreds of people. This is what's needed for this person. Right? But that's my stance. I can't put that on everybody. So
Right.
that will have to be something that I'll have to be negotiated and worked through so that more people who need the care can get the care they need. And see, here's how, and I know I can already hear it. Well, that's similar to what happened under what Trump just did, right? Not quite. Trump just literally said, send it to the states. Okay.
Right.
The Supreme Court just said, send it to the states, which is always a bad move in my view. But if we have a national plan in place, this is the key. If you have the national plan in place, then states can't stop you from going to the next state to get the care. Right,
like
now, because we don't have a national umbrella on this thing, the states can say, nah, you can't leave a state, and we're not going to give you the care in this state. Right? So it's not a perfect solution, but it at least removes that piece. Right? It doesn't help the girl in East Texas who can't get to Louisiana, but it will help more of the girls in Texas get to California. Right? So
I mean, that's just I can imagine sermons from the pulpit. I can imagine. I could just literally hear, well, we don't want our money going to killing babies, and it's all about now. Keep in mind, they're not providing daycare. Let me backtrack. They're not providing contraceptives.
No,
they're not covering those, which would make the most common sense. If you don't want teenagers, especially to have children, you might want to consider, providing birth control and condoms and those type of things. Those things should be, free also. But you're not.
But they want to make in vitro care free.
Yeah.
Like
what? And then make it so if you say, I don't want to do in vitro, I'd rather adopt a child. Make the fee for hiring a lawyer to adopt a child is high. So what are they really saying? Right?
What they're really saying is they want control over women's bodies, and that's all baked. That's baked into the whole male supremacy crap. It's baked into religion. It's baked into all those things. But, and this just occurred to me as you were explaining that. All right. So remember I said there'll still be a private market, right? So if you want to opt out of the national plan, because the national plan, in my view, would cover everybody, right? Now, there would be a few things I would cut out, right? For elective care.
Yeah, because you want to get plastic surgery.
Yeah, because it's such a lightning.
I want them bigger. I want the government to pay for my.
No, hear me out. Because I don't mind, protect the tatas. Okay. So if you want to have the surgery, it still is covered under the national plan, but it'll have a different deductible associated with it or something like that. Right. Because I think deductibles serve a valid purpose, even in a government program, because it reduces people just randomly showing up and clogging up the system. Okay. But you want to have a breast augmentation or you want to get your nose job done. Okay. That's elective. It's not necessary. I mean, because to the individual it's necessary, but to broad speaking, it's not necessary. Fine. Here's a deductible or the copay, whatever we put in place. And for those out there who aren't familiar, a deductible is the amount of money that you have to pay before you start getting benefits, okay? Versus a copay, which is a fee. Copay just says, in order to have this service, you pay this amount of money. They're different, okay? So if you want to have a breast augmentation or you want to have a penis enlargement surgery because of you just what you want to do, right? Pay your copay, get your service. But if you're in a bad car accident and your face got disfigured and you need reconstructive surgery,
Oh, well, that's different.
that's normal care, right?
Yeah, that's
That's
normal.
Yeah.
right. So, or you were born with a cleft lip, or you were, these are things that are not elective per
Right.
se, right? There's a case you can be made for it, but I think that's where you will hash that out, and there you go. And then when you get to the abortive care situation, okay, here's what I would propose, and I want your thoughts on this, each of you. I, individual A, want to have this procedure done, whether it's because of a complication or I simply want to terminate the pregnancy. Because to me, that's one and the same. It's up to you. It's your body. But let's say that's the situation. Then you can opt out. I'm sorry. All right. You oppose that. You oppose ever having to pay for that. Okay. You can opt out of the national plan and you can go get a private plan. And here is a subsidy towards what you're doing. Right? So you have decided, I just can't, Hobby Lobby's argument, I just can't, I get the vapors when I think about the poor little babies. Now, I don't care what happened when the baby gets here. See, when the baby's
don't give a
inside
crap
of you,
about what they
right.
on their own.
When the baby's inside of you, that's my responsibility as a God-fearing person. But once that baby drops out of that canal, well, that's between you and God. Because see, God couldn't see you in the belly, neither could I, but whatever. You're right. So let the people opt out. You want to opt out, and go to the private industry. So now you ain't paying for nobody's coverage but yours. Your premiums are going to suck because it's going to be less of a pool. But go do that. And here's a tax credit towards the cost of your care. Right? You're not being punished per se because you didn't want to participate in national plan. So we're going to help offset some of your costs. Not all of it, but some of it. Go be free being however you are. Meanwhile, for the rest of the people who do need this care, want this care or whatever, it's covered. As long as your doctor signed off on it and there we go. What are your thoughts, pros, cons, takeaways, changes? What are y'all thoughts? Because I'm just a dude.
I'd be all right with that. I mean, because we know that there are times when it becomes medically necessary to end a pregnancy for the mother's life. And the way things are going right now, you can't get that in some states. That, to me, that should be between you and your doctor, and nobody else should be able to say yes or no. Really, I'm fine with if people want to opt out, they don't like being a part of the system. Okay. Once again, that's a part I had not thought much about. So
I think the opt out, and I don't want to say this crassly, but I think, yes, personally, I don't believe in the opt out. It's like, this is the care you're going to get, suck it up, buttercup. That's what I personally believe. Me, this person right here. However, if we did go with the opt out version, I want you to pay more. I want to give you $500, just give you the bare minimum. I'm talking about the bare minimum. And of course, I believe that national health care should include vision, dental, pharmacy, medical, all of it should be, because my eyes are a part of my body. But you shouldn't get the same benefit as somebody in the national plan. If you're going to opt out, because you're so opposed to, okay, opt out. That's cool, but you're gonna pay more, and we're not gonna. If it costs you $1,500 a year, that's a low healthcare cost because it's gonna cost way more than $1,500. I may give you two. The other 13, that's on you, boo. That is on you. Don't look to me. Don't come to me. And when I get prescriptions for free and you got to pay for them, I don't want to hear it because you opted out. You chose to opt out. I'm for the opt out if we did that, but I don't want to hear whoa, how come they're well, because they chose to stay within the system. You didn't. There has to be some type of, I don't want to say penalty, but I guess that's what I'm talking about.
Yeah.
Because I'm like, well, you are deciding it's okay for you here's what I'll say to the people that are anti-abortion. If you are against abortion, don't have one. That's a really simple thing. Don't have one, but
their
don't
money's
take
going to.
But federal money doesn't pay for abortions anyway.
No. Well, it does, but it doesn't. Right? Like if you're talking about a national plan, it absolutely.
Under the national plan, it would. Okay, so
yeah.
if you're so opposed to abortion, okay, don't sign up for it. But don't be like, well, why come I don't get free vasectomies?
Yep.
Free
Viagra.
Viagra. Yeah, let's ban Viagra. Let's ban it. Let's ban it. We're gonna just
do it. Go all the way.
I'm for the go all the way with it. I can be cool with the opt out, but you're gonna opt out all the way. You're not gonna just get some of the benefits and get no. Well, you want to opt out, mess around and find out.
So I'm with you. I presented it the way I did because I don't believe isn't the right word, but I don't think that a punitive approach is the way to get to where you want to go, because then it makes you no better than the people you're trying to combat. So that's why I said there would be a tax credit for those who opt out. And like, I know
it wouldn't be. Just give the bare minimum.
I want to say cost of insurance for me is around about $1,000 a month. I think it's around that for me and my girls. And this dumb laws we got right now, because my wife has a job and that job allows you to have health care, she can't be on my health care.
Nope.
This is stupid. It didn't used to be that way, but somebody decided to make that switch. And I want to say it probably was an unanticipated aspect of the Affordable Care Act, but that's just what it is, right? But I pay about $1,000 a month, so that's what, $12,000 a year. So let's say that that was still what my tax, now instead of it being a premium to the insurance company, that would be my taxes. So now my taxes are $1,000 a month. Okay, cool. So I would say, so if I decided, hey, I don't want to be in that national thing, man, because there's too many things. You know, you give in as a inmates realignment surgery, right? I don't want to be part of that. All 4 people in the whole nation.
Yeah, in the whole world.
But okay. But that's your position. But that's your position, right? Or that's my position. Say that's my position. It's hypothetical. Cool. So I opt out. I go get a private plan. That private plan, just so people understand, once you shrink that pool, the premium starts going up, because what premiums do, sorry for this little commercial break, what a premium is, folks, is you sharing in the cost of insurance. So when people say insurance companies have no point and no value in the insurance, in the healthcare industry, they are wrong. They are very wrong. It's just that they're abusive. That's the problem. So if you did not have insurance companies, I'm talking about in our current world, if you didn't have insurance companies, that means every time you went to have care, you had to pay the full price. What the insurance company does is you're paying $100 a month or whatever or in my case, you're paying $1,000 a month. Well, okay, January, I pay $1,000. I don't have nothing happen. I ain't got to go to the doctor. I'm cool. February, same thing. March, Same thing. I have now paid $3,000 and I haven't had to use one lick of insurance yet, right? April comes and I have whatever situation, because it don't take much to make your experience to have to pay a lot of money. April comes and I now have a $10,000 outlay. And anybody who spent any time at the hospital, that could be a day. Okay. So
Nope.
$10,000 outlay. Without insurance, I have to come up with $10,000. With insurance, I can now go get care, and I've only paid $3,000. And the only reason I can do that is because each of you have been paying that money.
Yeah.
So health insurance companies serve a very important purpose. The problem is we also live in a hyper-capitalist society,
Yes.
which has decided to profitize, or whatever the right term is, healthcare. So now your premium isn't just sharing in the cost of insurance. Now your premium is paying for the private jet, it's paying for the company outings, it's paying for these dumb bonuses and extra, dividends and all that other crap. That's the abuse. So that's why I push back when people be like, well, we don't need insurance. Yes, you do. That's why you want to go to single payer. Because guess what single payer is? The government becomes the insurance company. Okay. So it's still, yeah. But anyway, Parker had a question. Let's see what y'all think about it. Do you think people should be able to opt their children out, or would everyone under 18 automatically be opted in?
Oh, that's a good one.
Hmm.
I think if you care about your children and you say you love your children, you would opt them in. But apparently, some people don't believe in vaccinating their children and opt them out, and therefore make other people sick. I'm going to go on my COVID rant. I'm on it. Because when you have a chronic disease like diabetes and you get sick because some nitwit didn't get their vaccine, somebody said, I'm not going to get it. It's a conspiracy. We stay sick longer than the normal person. You think if you get a cold, you may have it a day or two. I could have a cold for 2 weeks. 2 whole weeks.
Months here. Yeah.
Months in. Me 2 weeks. When I got COVID, and I'm hearing people saying, I don't want to get a shot. I don't want my children getting that vaccine because it's got placebos or whatever they were saying, whatever garbage they were saying. Children automatically, this shouldn't even be a question to me, because the children, that's just automatic. You want your children to have special care, especially if that child is born underweight, especially if that child is born with a chronic disease, especially if that child is born with a disablement. You're not going to be able to bear that cost on your own. Shoot, a pair of eyeglasses cost me $300 for one pair. So if you got money like that, loan me $20. Because I'm just saying, I think that it's truthfully for children automatic. I think it's automatically in some states, not Indiana anymore, that you had to have vaccines to even have your child admitted to schools.
Yeah.
Because when one child gets sick, they all get sick. You can't, children, that to me, that's just automatic. It's like, no, you do whatever you want to with yourself and your body, your choice. But that child, nah. I see you when I see you, and you can miss me with that.
Anna?
I am really torn because I also rely on herd immunity. There are some shots that I cannot get because I don't have much of an immune system. And because of that, I make the choice to not be socially around a lot of other people. It would increase my chances of being too sick. So say, given that, I don't know how to go backwards. Once we start saying you can opt out, it can't be for the kids though, and you, their guardian, cannot choose that. I do not see that legally winning out. Um,
Well, what you could do to answer that question, if I can,
Mhm.
like in the state of Indiana, no matter what the child's income is, if they're born, they automatically get registered with Medicaid. Then after a year, the parent can say, you know what, I don't really need this anymore. I'll take my child off, or they can pay for the package C plan. There is
Okay.
that option. I
We have
just don't like
something
to
to
leave
call peach
children
carry.
just uncovered, and you just gotta, because that NICU that will take your whole budget and wipe it out.
Yeah.
Yeah.
So I'm sorry, Anna, did you want to continue?
Oh, sorry, Anna, to interrupt. I didn't mean
No,
to.
no, we're having a conversation, and I basically said what I've thought of so far.
So I would say, because here's a couple things. So first, I don't believe that a person belongs to another person. You've heard me say this in other contexts before, right? So, like, for example, my wife, she does not belong with me. No matter how she does not belong to me. No matter
Sure.
how much I believe she belongs with me, she does not belong to me, right? And
Mhm.
my children gets a little bit more gray here, right? Because these are my babies, right?
Right.
These are the ones that mean the entire world to me, and they carry my DNA. But I still say they do not belong to me. I believe this is my personal belief system, and I'm very sensitive about putting my belief system on other people. So my belief system says that these children are gifts to me, and it is my responsibility to care for them until such time as they can care for themselves, right? So they still don't belong to me, right? They belong to my concept of God. So because my concept of God is different than how like Christians and everybody else look at God. So to me, I am their caretaker. There's a gateway that brought them to me. However that happened, but these are the ones that fell out the system and they carry my DNA. And I am responsible for making sure that I give them an amazing childhood as best that I am able to do so. And I keep them healthy and strong and away from hurt, harm, and danger as best as possible until they're able to move on. And it becomes their turn to either do the same or whatever their life dictates for them. Right. So that's me. That's me. So I
Reasonable.
have to now arrest that though, because this here poses a very interesting dilemma. So I think that once again, having universal or national health care is it's a it's a national right. It is a right of citizenship. All right. It's not a God-given right. Like I hear people say that. No, God didn't write insurance plans. Okay. But it should be a national right. So your child, as a citizen of this nation, should automatically be born into the system with that coverage. Now, I also don't want to intrude upon someone's religious or their personal, deeply held personal beliefs. So I have to then allow a parent to opt their child out. As much as I disagree, as much as I feel like that child needs whatever, care and everything else. But I also say that, like, if an adult opts out, this is just me, because I think you got to have controls in some respects, but I don't believe in being punitive in things. So I think as an adult, you opt out, then you cannot opt back in until the next year. Can't do it. Can't do it. Sorry, because you're not paying in. So, no. Now you can change your mind next enrollment period, which is a year from now, or whatever we structure it to be, right? Because I think that should be a holdover, even on the national plan, right? You should be able to decide every February if you want to stay in the national plan, or you might want to try out the private market. It might be what you want to do. Do that, right? Fine. Let's keep your rights on the table. You have to wait until the next enrollment plan, whether that's 1 year or 2 years. But your child, you can opt that child in or out at any time you want to. You can say, I do not want my child in this program because I believe that as long as they don't get kissed by a snake on a Tuesday, they'll be okay. Fine. Opt them out. You don't want them to have vaccines. You don't want to opt them out. That's your right as that child's parent. But then your child gets sick.
That's what I was going to say. There you go,
Opt
right
child
there.
in. You have the right to opt that child right on in because your child doesn't pay taxes. Your child is an in my view, your child should be an investment in the nation. The nation should invest in every child in this nation because the only way this nation continues is through our children. Right? So, fine. Opt out because you don't think nothing bad can happen. And then Timmy falls off the monkey bars and breaks his arm, and you got to drive him to the emergency room. Sign up right there in the emergency room. I want Timmy in the program. Now,
okay.
But once you do that, Timmy's going to get vaccinated while he's there because that's part of the national program, right? So I just think that the child should have 100% able to come in, come out if the parents decide to do that because I want Timmy's arm fixed. Okay.
Yeah.
But, okay, so when Timmy gets the measles, okay, opt him in, right? But we're going to do these things. And if you don't want to do that, then that's still your right to stay opted out. Sucks for Timmy, but these are the parents he was given. But you're about to say something, Tracy?
I only have one kind of caveat. If that person is 18, from what I'm hearing you say, and they opt out, they can't opt out until the next year, whether that's February, March, January, whatever it is. Let's just say that person gets diagnosed with cancer or ALS or hypertension or diabetes. Let's just give them diabetes. And I'm gonna be nice. I'm not gonna give them type 1. I'm gonna give them type 2.
You get diabetes.
Yeah, everybody gets diabetes. I'm gonna give them type 2 diabetes because that's more people have type 2 diabetes than have type 1. Do they get to opt in now because they have a chronic disease, or do they still have to wait? Because diabetes, even if you got type 2, it's not gonna wait. You need your metformin. I think at that point you can take metformin. You need your metformin and your hydrocolizide, and you need all of that stuff, unless you're gonna just become vegan. But it's the more manageable one because type 1, that's just because I believe if you're gonna do that, type 1 should automatically get to opt in as soon as they find out they got type 1. Because type 1, you don't make insulin. You don't have a choice. You're just out there. You just like, oh, I don't make insulin.
So here's what I would say. For a child, I think however they came to this number of 26, I like it much better than 18. So I would say keep that number. It wouldn't be 18. Because a lot of 18-year-olds, they're grown, but really they're fully reliant on their guardian, right? And even if they're not mentally there just yet. So I would say keep the 26. as far as that part goes. And then let's say you're a 42-year-old grown-up person and diabetes type 2 knocks on your door. I hadn't really thought about it, but I think something we would look at perhaps is you can opt in, because that would be one like we do currently under our health insurance plans. That's like an unexpected emergency type of thing. Kind of like if you get married or you get divorced, you're able to opt in or out of plans, right? So maybe something like that. But because this is tax-based, right, you may have to pay a tax penalty. So you can opt in because of these qualifying life events, right? You're supposed to do it in February, but it's August and life went sideways for you. Okay. I don't want people going bankrupt over medical expenses. And I don't want people afraid to go to the doctor for a medical expense. But I also don't want everybody to just wait until something bad happens to decide they want to come in, because that's a moral issue. That will break any system you put out there. It just can't be allowed to be the case.
Yeah, and I chose type 2 diabetes for a reason, because like I said, if you're type 1, I was diagnosed type 1, I was 27. Usually people are diagnosed type 2, type 1 as either infants or small
teens.
children. It's usually, or teens. That's like the ladies. I was all the way up to 27. So let's just say it's me. Well, they say, Tracy, you got type 1. You don't even make insulin. Now we already talking about $5,000 worth of care just that's my starting point, because I got to get a continuous monitor. Most likely going to have to go on some type of pump. Most likely going to have to go on some type of long-acting, short-acting insulin, whichever one. That person don't got a lot of money. Like, what type of tax are we talking about?
I get it, but Tracy, you're 27 years old. You decided to roll the dice. So you roll the dice and it rolled up snake eyes. Okay. So now you want to get coverage because you thought you could run. You thought you're going to be fine. I'm young and fine. I can do whatever I want to. I'm good. I don't need that. Okay. Life showed you what life was about to do. Okay. That's a qualifying life event. I think it would be, right? And so you can opt in as an exception basis, but now you're going to have a tax penalty. And if your income is too low for a tax penalty, then you're going to have some other kind of penalty. Something's going to happen, okay, that you have to address to come in now. Because if we don't, and see, people didn't like this about when Obama was talking about it, but they didn't understand the logic behind what he was getting at. The reason why you have to have some kind of a penalty tied into this is because there's a thing called a moral hazard, okay? Or adverse selection is another way they put it. If there's no penalty, there's no barrier, there's no downside to waiting until I fall off the monkey bars, then I'll just wait till I fall off the monkey bars. So now you're only going to have sick people coming. Right?
Yeah, but preventive care would have helped you if you had done the preventive stuff. You could have caught that.
Could have caught it sooner, things like that.
But you could have caught the type 2 because it is reversible.
We could have caught you at pre-diabetic, right?
Because if you got pre-diabetic, you can beat that. That's just a PSA. That's a PSA for the day. I'm giving them out. But that's the only thing that I'm thinking of, because I'm thinking, there's other disease like cancer. Oh my goodness. I had a cancer scare and I'm like,
Once again, though, you're an adult who opted out. Right?
I mean,
so that I know it sounds a little hard-hearted, but
yeah, that sounds hard to me.
It needs to be. You can still opt in. I'm not saying you can't come in. I'm saying that you made a choice when you were healthy that you weren't concerned about contributing to the national care. Because see, all your money that you're paying towards this, now these are all tax revenues, okay? But all the money that you're paying towards this is so that when I'm paying my premium, in this case, my taxes, a lot of taxes, It is so you, Tracy, can get care. That's the point. I don't need anything, right? I go to the doctor now because I'm 40 something years old and I got issues I got to work through now because I'm 40 something years old. But when I was 30,
Yeah,
35,
that's a mistake a lot of Americans are making, especially with, I'm going to pick one. I'm going to pick an issue, bariatric surgery.
you got to help me. What's bariatric?
Bariatric weight loss
Okay.
surgery.
Yeah.
Before, if y'all don't know, I used to weigh 299 pounds. I don't weigh 299 anymore. And I had my mind set, I'm going to have weight loss surgery. I'm going to do it. All the things you have to do. This is a good case for national. When you are so morbidly obese that you can't move, you can't function, your heart is affected, your kidneys are affected, your liver is affected, your blood pressure is high, you probably have diabetes. You have to not only have the surgery, you got to have psychological visits to make sure that you mentally understand, how did I get to this point? How did I get to this point?
Stay in it.
Anyway, and what I'm emphasizing is no matter what type of plan we get, because I do believe we will get there, we have to start emphasizing preventive care. Those are everybody, no matter what age you are, no matter whether you're a 555, 105, 205, you need to take preventative steps, because if you take preventative steps, you can avoid a whole lot of stuff.
But that's always been the case. Like if you just go walking, if you don't eat cheeseburgers 5 days and you don't eat them 2, or
here's
I get what you're saying, Tracy. What I'm getting at is this, because this is where you're gonna get somebody like me who kind of pushes back, right? Because I got to fight with weight issues and things like that, but I haven't crossed over the cliff yet, right? So then my feelings would probably change if I was on the other side of the cliff, okay? But where you're gonna have pushback, especially when you talk about weight loss, is if it was a trend line that got you there, people are a lot less sympathetic. But if it's a thyroid issue, if it's a mobility issue, if it's something like that, people are a lot more understanding there because they understand there are some things that got in the way. Should that be the case? Maybe, maybe not. But if a lot of people right now, this is just the reality, and I don't have the numbers, but I have anecdotal because I run across a lot of people and how popular Ozempic has become, not only in the celebrity world, but in the private world. That's elective for most people. Now, there are people that it is medically necessary.
Yes.
But that's where the doctor comes in. That's why you have the doctor.
Right.
Because if you need it, and I'm not doubting your need for it, right? You need bariatric care. I think that's how you said it, right?
Bariatric surgery or weight
loss. It is a medical need. You either need your stomach staple, or you need Ozempic, or you need whatever other shots and care that you might need, or you may even need to have reconstructive surgery to help relieve some of the weight quickly, so that you have to go through that process and then the skin grafts and all that. If it is the doctor said this is what we need to do, then guess what? That's part of the national plan, right? But if it's just because I want to be a size 36 and I'm a size 48, well, your doctor better sign off that it's medically necessary. Otherwise, it's going to fall on the elective side. And you need to pay your copay.
Yeah, you do realize Ozempic and GLPs, because it's a GLP, that was made for people that have diabetes. It's the rest of y'all that jumped on it. Y'all jumped on what was for us.
I get it, but this is where we're shifting, right? So, like, part of like the angle that you've taken a couple times in the discussion is kind of punitive, right? So you should have known better. So this is where you're dealing with, and I agree to an extent, because that's the argument I'm kind of making right now with the weight thing. But that's because I have a bias. I have a bias because I know that I could do better with my weight if I would just be more active. I know all the things to do. I'm actively choosing not to
Not
do
to do
all the
them.
things that I want to do because it's
Right.
uncomfortable, because I have mental blocks, right? That says, no, but I really like this thing, right? So, which I
Yep.
love that you brought up, that you need consultative care. You need someone to help you because otherwise your brain will block you from certain things.
That's
I'm with
all
you
I'm
on all of
saying.
that. My thing is, if the doctor says this is medically necessary, then that's just medical care. The national plan covers you. Let's go. Even if, because this is the thing about insurance, I used to, anecdotal, but or a sidestep, I used to be a claims adjuster. I was a claims adjuster for many years, and I dealt with auto injury and auto accidents. That was my thing. And one of the things that they taught us is that yes, we insure stupid. Okay, because it's like, wait a minute, this I just went out to do a claim. This lady thought her car was in reverse, but it was in drive, and she drove it right into a concrete post. It was
Yep.
her fault. Why
That
am I
can
paying
happen
for
to
this?
anybody when she's 21 and just got her license and her
It don't
name is
matter if she's
Tracy.
50 or 32. We insure stupid. You got out the car, didn't make sure it was in park, and it rolled into the lake. We insure stupid. So you have a French fry fetish. You just love French fries. French fries are what you love to eat. You go to sleep on a bed of French fries. Hell, you even have sex with French fries in the left hand so that you can do other things with your right hand. Whatever it is, we
Wow.
insure
Wow.
stupid. So the doctor says you need this care. You should have known better. You should have gone for walks. You should have ate more vegetables. You should have whatever. Yes, all those things are true. You should have done all those things. Shame on you for not doing those things. But here's where we are now. You need help now. So get the help you need. Because at the end of the day, before all things are considered, you are an American citizen, and being a citizen of America should mean something. And that one of the things that it means is that we care about each other, because the better each other are, the better we all are. Let's go. All right. But we've been going at it for almost 2 hours. So
Yep.
I'm going to wrap because I really wanted, and this is my fault because I'm not good at hosting. I've never been a host. I've never been a good host anyway. So like we never got into how we're going to fund it. We didn't get into, we really didn't dig too deep into elective, and we didn't talk about fraud and abuse and controls because these are things that matter,
Mhm.
right? And we didn't get into how you're even going to truly structure this monster. Is it going to sit under the executive branch? Is it going to, like, which means we'll fall under like health, HHS,
Health and
health
Human
and
Services or the
human services, right?
CDC.
Would it fall under there? Would it be its own thing? Like, we didn't get there. We didn't get to talk about those things. But I think those are things that would be important, right? And then, like I was saying about funding it, you know, this is a it's not a regressive tax, but it is one of those things, right? The people who will probably use it the most are the people who are the least healthy. The people who are least healthy by the numbers and by class are going to be some of the lower classes because they have food deserts that they got to deal with. They got a lot of number of different things. Stress, all that stuff. Stress sits heavier at the bottom than it does at the top. So how are we going to fund it? Right? How do you decide what the taxes are? Are we going to use like the insurance companies do, where you have actuarials who determine what your premiums would be? And then in this case, these are your premiums, but we'll call it a tax. Or do we just increase how much your FICA is? And for those out there who don't know, that's just the federal tax that we use for Medicare and
Social
Social
Security.
Security. Okay. So we're not talking about getting rid of Social Security. This would get rid of Medicare, in my opinion, but we're not getting rid of Social Security, right? So we got to figure out how you structure that. Because if I'm a doctor making $200,000 a year, should I have to pay more for health insurance than the person who makes $60,000 a year? I don't think so. This is about health insurance. This ain't about general taxes, right? So how do you account for that?
Hmm.
You know,
There's a
but
real easy answer for that.
well, go ahead. What's your answer? Because we're going to wrap. But what are you?
Stop funding all these stupid, useless wars and cut military spending. The end.
Okay, so no, that wasn't a very. I wouldn't agree that that was the best answer, because a couple of the issues, and you touched on this a couple times, and maybe not just this discussion, but I think last night when I was listening to your show. So there are allocations and there are appropriations.
Oh
Okay.
yeah, that stuff. But you know,
So when you're talking about spending, domestic spending, those are allocations. It actually has to be written into the budget. This what we doing. This, they actually have to make numbers for it. War is an appropriation. It's gonna cost what it's gonna cost. And we just run up the tab, right? And the problem with our military spending is they get to play on both sides. They get to play
they
on the
sure do.
allocation side, and they get to play on the appropriation
Okay,
side.
I'll rephrase it. Cut
Mm.
ICE funding.
That's another show. I would love to have that conversation. Y'all let me
Like,
know if you want to put that together.
I can change up.
Huh?
I said I can change up.
Yeah, I don't think that will work for this either, but I think that what we do with ICE and immigration enforcement is important, and we need to figure out how do you do it. This ain't the time to have that discussion, but I would love to have that discussion. You can have it on your show, and I'll be happy to join if you want, or maybe one day we'll do another one, or Anna, if you want to throw it together, put it together, because I can't be sure when I'm going to do something or what I'm going to talk about when I do it. So closing thoughts, floor is yours.
Anna, you can go first.
Yeah, okay. I mainly have seen a world where myself and other patients like me and our doctors have been told no by insurance companies, something that our doctors thought was medically necessary for us to have a good quality of life. And insurance is just like, nope, not gonna do it. And like the people that I always call and argue with my care, they are not doctors themselves. They are not people who have had any kind of a medical background, even whether it's a degree or they have had a life where they've been in and out of doctors and hospitals and all that. I would like to see a system that is built upon what a doctor and a patient need. Like when we went and made a free clinic for our town, we got the doctors for that, the nurse practitioners, and then we were like, what do you need? We need people who are going to greet people up front. Okay, so we allocate funds for that. And we managed to get a lot of things done for our community for no cost to our community. It's because we believe this is something that our community should have. And that I greatly believe that when we start to look at the system, what do we want? There should be a lot less hands going into the pie for the actual decisions. I would love to see more conversation around what we would like to see. I'd like to see a part 2 to this conversation. But no, I greatly love listening to you both because you both bring things that I just haven't considered yet.
That's
And
really sweet of you to say, Anna. It sounds like you were in the middle of sharing something there. What were you about to
God,
tell
is
me?
that you?
wow. No, that
Speak
was
when he speaks.
no, that was Alexa.
Oh, because I've always said that God was a woman.
Won't he do it?
Alexa, cancel.
Hey, he did say he'll make the rocks speak. So I mean,
Yep, they'll cry out.
Okay, okay.
Tracy.
Thank you.
I will always, always, always believe that at my core, free healthcare is a right. It's not a privilege. It's not something you get because you're Black. It's not something you get because you're white. It's not something you get because whatever ethnicity, whatever sexual orientation, whatever your ideology, your theology, your whatever, whether you're Hindu, Buddhist, Jewish, Christian, whatever you are, you deserve health care because you were born. And we didn't even talk about this. We need to start looking at some of these not so nice politicians, because I could call them words, that are taking money from insurance companies that are preventing our care. They are literally getting in the way of doctor to patient care, and they do it on a large scale, i.e., United Healthcare using AI to make
United.
decisions. They use AI to make decisions about healthcare, and that impacts people. Whether it's a routine physical or something we didn't talk about, behavioral health.
Mhm.
We didn't even touch behavioral health, and that's a very, very vital part of
We
healthcare.
touched on
You
psychological.
did.
Yeah.
Yeah.
Not as much as I would have. Not as much as I would have liked.
No, I agree. We
think,
didn't dig into it.
Mhm.
No. We just said it should be covered.
but I think that's a part of it. And my core is always going to believe we need free. If, like I said, I don't care what you call it, except for don't call it Trump care. That's all I ask.
I
Don't
don't
call
care
it
if you
Trump
call
care.
it Trump. You know, you could call it Trump care, put his face in the corner. But if it has all the pieces that I want, and we can improve on it later,
You
run
know,
it.
if he signed it, it's not going to have all the pieces.
That's the problem.
That's the
Yeah,
problem
I mean,
right there.
hey, Obamacare
but-
didn't have all the pieces. Obamacare got a lot of issues with it, but Obamacare is what gave us coverage to age 26. And I think that has been incredibly helpful to a lot of people. And it made coverage available to a lot of small business owners and their families. And I think that's incredibly helpful. And it got rid of the
existing conditions.
Existing conditions.
This is incredibly
That's
helpful.
only good.
But it also was like a lottery
But that's
draw
coming
for
back.
the insurance company.
Yeah, so that's gonna always be in my core. I'm always willing, able, and ready to discuss this because we've been fighting for this for 100 years plus. I'm tired of fighting. I want it now. If I don't get it, I'm gonna start taking stuff. I'm tired of this. Write a letter to your Congress. I'm not writing. I'm not writing it.
Put the Band-Aid back, ma'am. I saw you. Give the Band-Aids back.
Take them Band-Aids, Tracy. Take them.
No, because I'm tired. I'm tired. We got to get in this. We got to get in this fight. Stay in this fight. Because we got some real ignorant people sitting their butt. One of them sits at 1600 Pennsylvania that doesn't want you to have what they have. Everybody should have it.
That would be a political discussion, which I think would be a lot more contentious.
Don't
But
care.
yeah, I'm going to leave you with the analogy that Marlon had put about a car, right? I thought that was really good as far as politics are concerned. You know, if people have a car and they think all they have to do is drive the car, and then they complain when the car breaks down because they didn't do any maintenance. And what I say about that is that's how politics are in America, because we all have an expectation of what politics is supposed to do for us and where it's supposed to take us, but we're not responsible owners of the political system. All right. We insist that politics is supposed to perform a certain way for us, but we don't want to be serious about maintaining the fluids and making the judgment calls on when you need to change your tires and all those different things. So I leave that at that. We could dig in much deeper another time, but that's why I said politics would be much more contentious, because I don't think we'll all be aligned there. But thank you.
Healthcare should be free.
I don't know about free. I don't want free healthcare.
Free.
Well, if it's free, who pays a doctor?
Right.
The government.
With what?
Money.
From where?
Oh, okay. So I'm an MM here. So I got to start explaining all of that. Okay, I'll wait for another time to explain that. I'm like, because that's the whole discussion in itself.
Yeah, that's going to be the MMT just print some more money argument, and that no, but free means free. The word means free. That means nobody paid for anything. Here.
Just like the COVID shot. We didn't pay for. I didn't pay.
Yes, we did.
Our taxes paid for that.
Yes, it did. Because we had to pay the insurance. We had to pay the manufacturers to not charge us. And then once the money stopped, then those manufacturers are like, well, I guess if you go to CVS, you're going to pay a little bit of something. But they were also making money because they were selling it across the world. But no, wasn't free. So no cost is not the same as free, folks. That's just a little bit of marketing knowledge for y'all out there in La La Land. No cost is not the same as free. So yeah, thank you truly, both of you. You hung out with me for quite some time tonight. And I hope you have an amazing evening. So before we drop, if you like to big up your platform and your content, go ahead.
Tracy, go ahead.
I am back. I am back after a 2-month vacation. Been hitting that Thursday with 2 interviews so far. Saturday, I will be on at 7, ranking the Legion of Doom. And then Sunday, the Sunday show, y'all already know. I'm back, and I'm glad to be back. Tracy Media 74 on YouTube. And I have finally hit 400 subscribers. I'm so happy.
Congrats.
Congratulations.
Yeah, I got to that number. So now we got to hit that 5 so I can get closer to where Marlon's at. Marlon's in that dreamland. He passed me up.
I got like 53.
I'm not even saying. You can find me at borreliaetc.com. It's Borrelia is the bacteria that causes Lyme disease, and I use the etc. because there's a whole bunch of other stuff that happens when a tick bites you. So if you wanted to learn a little bit more about that, hit the website up.
All right, and this is Theus, Complex Mind, Simple Man. And yeah, every once in a while I go live because I don't want to do editing anymore. So this is where you see me. Y'all have a good one. Bye-bye.
Night.
Bye-bye, everybody.